Just kidding. Yeah.
Okay.
We can get it.
Hi Ryan. We've met in many other clinical scenarios before. Today I know you're 3.5 weeks into your Facet sprain rehab, so today we're going to try to still continue to increase range of motion where it might be limited. If you have any muscle spasms still left in the area, or muscle tightness that might be causing hypomobilities in the C-spine, or general pain still in the area or stiffness, we're going to try to use ultrasound today to try to add some heat, get that area warmed up, and give you some flexibility exercises that will keep the area moving well. Any deficits in strength also we'll address today and give you some exercises you can do on your own to help with that. We're going to continue to focus on your posture and make progressions in that to increase difficulty as we go along, so that you can continue to incorporate this into your daily activities. I know you've been doing a lot of biking, treadmill, more cardiovascular type things lately, so we'll continue to maintain that, as well as maintaining the logbook that you've done for yourself, kind of keeping track of your pain and the daily activities that you can do with within your rehab for your injury. We'll focus on a little bit of scapular balance as well today. So continuing to increase muscle feedback in the area in your shoulder blades, making that area strong and making sure that your posture is strong from here on in. Other than that, that's going to be our primary focus today. We'll start to incorporate some exercises too that build on moving from scapular stability and general core stability overall into more functional things, so that you can start to return to sport, because I know you've been itching to get back onto the squash court soon. Mm-hmm. As always, we'll try to incorporate these as much as we can into a viable home program, so that this is easy to incorporate into your daily life. Sound good? Great. Do you have any questions before we start, or before we continue?
No.
Perfect. So what I want to do to start, what I'm going to do for a warm-up exercise, what I'll get you to do is go through the range of motion exercises that we did before. So I'll start by having you bend your head down forward, and then back up to your left, looking over your left shoulder and over your right. And then just tilt your neck to the left and tilt your neck to the right. I want you to go through that. We'll just go through it 5 times to start, so you're a little bit warmed up in all directions. So after that's complete, any general muscle tightness, we're going to use ultrasound to help increase some kind of the flexibility of the muscles, and especially your upper traps. If there's any spasms still in the trap or general tightness that is causing hypermobility in the spine, we're going to try to heat that area up, loosen those muscles a little bit before we get started, so they're a little more mobile to work with today. So have you had ultrasound before? Okay. So as you know, basically what we're going to do is we're going to use it at a temperature and a setting that actually heats up the muscle. So what ultrasound does is it actually sends mechanical waves through the ultrasound head into the muscle, and it helps break down if there's any scar tissue in there. The waves actually bounce off, and they can actually break down that scar tissue, as well as brings new blood to the area to kind of refresh the area, and it makes the muscle a little more flexible, warming it up before we start. So before we do that, I'm just going to test hot and cold really quickly. So this will be hot, this will be cold. I'm just going to go over the area on the left side where I'm treating, on the left trap, just lateral on the left side to the T1, and right around the cervical thoracic spine junction. So tell me if this is hot or cold. Cold, hot, cold, hot. Good. Okay, so now that I've tested hot and cold, I just want to clear a couple other things. I noticed the area is clean. There's no hair there, and it's not dirty, so I don't see any signs of infection. Do Do you have any like diseases like cancer, diabetes, or any conditions that may result in like altered sensation or reduced sensation at all?
No.
No. Do you have any pacemakers or like metal implants in the area?
No.
No. And you're not allergic to ultrasound gel?
No.
Perfect. And no infections, right? That's what you said. And no cancer or anything like that?
No.
And no thrombophlebitis?
No.
Or deep vein thrombosis?
No.
Okay. So you're going to use a sound head on the area that we're doing today. So first, I'm just going to drape the area. Making sure that the ultrasound gel doesn't get on your clothes. Okay, so once that's draped, I'm going to put on my ultrasound gel to use as the medium. And then I'm going to use a frequency of 3.3 megahertz to get the more superficial muscle. I'm also going to do this for 10 minutes with a continuous frequency, so it's on 100% of the time. And I'll use a intensity of 1.0 watts per centimeter squared. If it gets, there is a risk that I'll move the sound head, but there is a risk of the waves colliding with each other if I don't move it fast enough. If that's the case, you might get a sharp pain. Just let me know right away, and I'll keep the sound head moving. If you want me to turn it off at any point, just let me know and I'll turn the machine off right away. If it starts to get too hot, let me know and I'll turn the intensity down. If you don't feel it enough, you can let me know and I'll turn up the intensity. Sound good?
Yeah.
Cool. So I'm going to ultrasound with those settings. I'm going to do, like I said, for 10 minutes to really heat up the upper fibers of the traps. There's no gel. So I'm going to go do the area for 10 minutes. Good. So once that's done, it's going to help relieve the upper traps a little bit. So before we get started with too much stuff, I just want to start with some light. I know that I've warmed it up a bit, so I'm going to start with some, to further increase the range of motion around your neck. I'm just going to do some trigger point release around the neck and around the upper fiber traps leading up into the upper fiber traps and the posterior and middle scalenes. So what you can do is lie down on your stomach with your head in the slow rest. And since you're still limited in left side flexion, I'm just going to do some trigger point release right along the upper fibers of the traps. And I'm going to find any adhesions and tight spots in the upper fiber traps and apply pressure for 30 seconds or until I feel the fascia and muscle release under my pressure. If I'm going too hard, let me know and I can ease off a bit. If I'm not going hard enough and you think I can push a little bit harder, let me know and I'll go a bit harder. Okay, so once I break up, so I'll do this for about 5 minutes, I'll break up some of the adhesions and some of the tight spots in the left upper fiber traps. You can sit up for a second. And just sit on the thing facing this way. So last time, for general upper fiber trap tightness, we did the exercises where you sit on your hands and then side bend your head to either side. What I want to do with that one is do the same exercise, but to continue to increase forward flexion, what I want you to do is bend to the side, and now add a component where you're tilting and looking towards the roof. So once again, you'll sit on your hands, you'll tilt your neck to the right side, and then you'll bend, rotate your head so you're looking up at the roof. And this is going to be especially important to increase the range of motion in left side flexion. Do you feel a stretch with that? Yeah. Good. So you're going to hold that for 30 seconds, then you're going to do the other side. Hold for 30 seconds. Good. And throughout this, like I talked about before, you're going to maintain good posture, being neutral spine through your whole core, being strong through your core, and keeping your shoulder blades retracted as we talked about before. Good. So once you do that for 30 seconds, you're going to do 3 sets in total, so 3 sets on each side, and you'll repeat this twice a day as part of your home program.
Okay.
The other thing, because we've been emphasizing posture so much so far, we're going to start to work on some more neuromuscular control and neuromuscular control through your shoulder blades at the joint below your neck, because that's going to have, because most of the muscles connect, many of the muscles connect from your shoulder to your neck. It's going to be important to increase the strength and the mobility in these muscles. So what I'll get you to do to start, you can lie down on your back on the bed. So what you're going to do with this weighted ball, you're going to set your scapulas on the bed. As before, just a very subtle movement, nothing where you're arching your back, but just keeping your shoulder blades a little retracted. So I'm just going to have it underneath, so go ahead, retract. Good, very subtle movement. What I want you to do is hold up this ball in front of you. This weighted ball, I think it weighs about 2 pounds. And just, you can use this hand to stabilize the ball if you want. But what you're going to do is you're going to trace the letters of the alphabet while lying down with your shoulders retracted. If you find, we'll do 2 sets of the alphabet for right now, and you can do this every day as part of your home program. If you find like halfway through the alphabet or at the end of your first set you're sore and you can't maintain that postural stability through your shoulder blades, then I want you to end the set there. We're going to try to build up endurance in those muscles so that they're really strong. And it's not so important that you make huge letters, but just subtle movements so that you're working on that core stability in your shoulders.
Okay.
Good. So once you're done 2 sets of the alphabet for that one, do you have any pain with that?
No.
Good. So the next thing I want to do to really strengthen those muscles in your neck, you can slide back a little bit just so your head's resting on top. And what I want you to do is we're going to do some isotonic exercises. So what you're going to do for this one, we'll start with bending. We'll just do this one. To start with this one, we'll do bending and rotation to your left to start. So what we're going to do is I'm going to provide resistance pushing the other way, and you're going to push against me. I'm not going to complete